Okay, so this is my early shoulder rehab, kind of an overall summary of what I would do. First, starting with the modalities I'd use, I'd first use a type of cryotherapy such as ice or Game Ready. I'd use this over the top, kind of down like this. The Game Readies would go like this as well, and we can also put an ice pack here. This is going to help with any of our swelling, inflammation, stuff of that sort. And then with this, we can also do NMES and or Russian for trying to get some of that neuromuscular control back. So if you want to turn that way, swing your legs off the other side for me. Perfect. What I'd do is I'd have the stim pads and I'd put them kind of on these infraspinatus, teres minor, supraspinatus early on to kind of get that rotator cuff to kick back on. And then later on, I'd work back into getting the deltoid and the pec major to come back on with the Russian. So that's where I'd start. I'd start on infraspinatus and teres minor, trying to get these guys Russian to kick back on. Move to supraspinatus, deltoid for some of that abduction, and then move to kind of pec and or trap. That's the NMES I'd use. I would then use, flip back over to the other side for me, keep that way. Since you don't have a shockwave in here, what I would use is a shockwave. This is just the example shockwave for today. But I'd use this on kind of the posterior capsule and the anterior capsules. I'd have the patient just relaxed here, and we can kind of shockwave down through this entire capsule, come down the posterior side. I'm gonna move your shirt up a little bit. We'd come working down the posterior side of the capsule, and we can also work through the anterior side of the capsule. Okay, and then next what we would do is we would do joint mobs. So if I'm gonna do prone for me. Just wanna work through some anterior joint mobs, just grade 1 or light grade 2 on the shoulder. What we would do is I'd have an arm kind of pulled up like this, and I'm just gonna kind of apply a light pressure, trying to elicit some movement anteriorly on that capsule. These would be super, super light, just for pain management and modulation. Okay, you're good, you can sit back up. Those are most of the modalities I'd use early on in conjunction with some exercises. So to start with the exercises, what I would do is I'd start with 4-way isometrics. If you want to come to the wall right here. What we'd do is we would do flexion, extension, internal rotation, external rotation. So I'm gonna have you do that for me, just push for like 2 seconds. Here's our flexion isometric, perfect. Turn around, there's our external rotation isometric. There's our extension isometric. And our internal rotation isometric, perfect. The next isometric that we would do is, my tool, is we would do some bicep isometric. So for just some type of thing to hold in their hand to kind of kick some of these tendons on. This isn't anything with weight, we just want to kind of use some grip work. We're having them stand up for me. We're going to barely flex the elbow at all. Hold an isometric here. We're going to come to the neutral, flex here, and then at the end range, and flex here early on. Perfect. We'll then do some pendulum swings, start to work on range of motion. So we're going to have them kind of bend over the table. We'll start with really small clockwise swings, and then counterclockwise, really small swings. And we can progress into bigger counterclockwise swings and clockwise swings, working it both ways. Next, I'll have you back on your back for me. We're gonna do some TA activation. So how I would teach the patient is to sit with their knees bent just like this. Find your hip bones for me. I'm gonna come just inside your hip bones. I got them, here they go. I'm gonna ask them to try to push my thumbs out. Squeeze your core, push my thumbs out. Perfect. And hold that there. After that cue, I put my hand under their back and ask them to turn those back on and push my hand to the table. And we're gonna hold here with a TA isometric. Perfect, you're good. Next, we're gonna do some of the distal arm work, so you can sit up for me. A lot of the shoulder braces come with a ball in the end that they can squeeze. We'd have them working with that, just kind of squeezing that ball, trying to get a lot of that forearm strength back. Great. We can then progress some of the distal flexion extension at the wrist, where we're trying to work the extensors with extension, and then flip it over, work the flexors with the wrist flexion. Okay, you're good. After the pendulums, we can progress to some active assisted range of motion with ideally a Theracane or a PVC pipe. We're gonna work through flexion with your left or move your right arm. Yeah. So we're gonna work through flexion, scaption, and abduction, going through passive, pain-free ranges, or active, excuse me. I'll take that, yeah. Next we're gonna do is we're gonna be back on our back, and we're trying to kick that serratus anterior back on. So we're gonna have our right arm straight up and out. We're gonna do serratus or scapular punches, where we kind of just protract the arm up and back down. So try and punch my hand without moving your back. Good, more. Good. Okay, next what we're gonna do is we're gonna do just some sideline external rotation that is just gravity. So we're gonna have this, I want you to keep this on your side the entire time, and I want you just to rotate your arm up as high as you can with just against gravity. Nice and easy, work with your pain-free ranges. No weight for now, just because it's early on. Okay, perfect, thank you. Next, what we would do is we would start with some super easy wall slides. So we have the sliders we'd use on the ground as well, but we can use these on the wall if you want to come over here. You're gonna just hold these with your fists and your elbows. You're just gonna push straight up wherever it's pain-free. If there's pain, stop. So fists on those guys. And then just push them straight up as high as you can go to where the wall will let you. Perfect, and back down. Okay, good. And then finally, the other early intervention exercise that I would use are just easy dead bugs. So we're gonna have them supine again. We're gonna teach them the T activation to where they're gonna push this muscle out, push my hand into the table, raise their legs, hands up toward the ceiling, and we're gonna do opposite arm, opposite leg, going down and up to wherever it's pain-free. Perfect, another way. Other side, excuse me. Okay, perfect. Those are my early shoulder rehab interventions, both modalities and exercises.